Good evening. The nationwide lockdown that was to end on Tuesday is now going to be extended by another 2 weeks, as indicated by the PM and chief ministers of various states. But there are going to be some exemptions and changes. Remember, you had the 21-day nationwide total lockdown ordered by Prime Minister Modi last month. It has seen all commercial establishments, all shops shut down, everything shut down except those selling essentials, food, vegetables, fruits, groceries, medicines. All of it has hit the economy hard, and now we're being told that this extended lockdown will have some specific measures, some specific changes for certain essential industries, agriculture, allied sectors, and some laws that will be modified to facilitate the sale of farm produce, to make sure the supply lines aren't affected and it reaches those who need them the most, which really is required to ensure that people stay indoors. This has also come on a day when the number of coronavirus cases in the country and the death toll have spiked. So we now have 239 people killed in India. There are 40 new deaths reported in the last 24 hours. The total number of coronavirus positive cases now stands at 447 cases. So this is going to stay, but nobody said it was going away anytime soon, but the lockdown certainly extended by another 2 weeks. So I'm sure we all have a lot of questions about how we can protect ourselves and our family members over the next 2 weeks, especially since this nationwide lockdown there are going to be certain exemptions for certain sectors. What does that mean since it's not a total lockdown? What do we need to do to ensure that we are safe over the next 2 weeks at least? And we have the best in the business. We have doctors on the show who are here to answer your questions, your queries, your worries, your fears, to dispel any myths that may be doing the rounds there. And today on the show we have Dr. Anita Sethi. She's the Director and HOD of Ophthalmology at the Fortis Memorial Research Institute in Gurgaon. We also have Dr. Monica Mahajan, Director of Internal Medicine at Max Healthcare. So Dr. Anita Sethi, before I come to you for generic questions, you're an ophthalmologist. So, that leads me to ask, the common sense question is that, we're always being told don't touch your face, which is very hard for most of us to do. We're constantly, fixing your hair and things like that. What about the eyes? I haven't heard anything about, not touching your eyes when we talk about not touching your other like ENT and your face.
Yeah, so the virus enters through the mouth and the nose mostly, but it can enter from the eyes as well. So really, it's don't touch mouth, eyes and nose. No part of your face should be touched because it's very easy to spread from one part of the face to another. It's interesting to know that one of the earliest doctors to come up, to tell the government that this disease exists was an ophthalmologist, Dr. Lee in China, and he unfortunately died. So as an ophthalmologist, we are equally exposed to especially the asymptomatic cases. Correct. So not touching the face, and a good way to not touch your face really is to wear a mask. Because not the medical mask, but the cloth mask, because that will go a long way in preventing you from touching your face. And if you are an asymptomatic carrier, you will not be spreading the virus. So that's one of the ways.
So when we talk about masks, somehow we don't say wear dark glasses, for example. And for example, what happens to people who are wearing contact lenses right now? So, would you encourage them to continue doing that?
You do need, if you are not looking after a COVID patient or near a patient, then you can wear contact lenses. But glasses, in fact, are a good protection because it's a wider area of coverage. So, and since nowadays everybody is working from home and spending a lot more time on their computers and straining their eyes a lot more, it would be advisable to decrease wearing your lenses because that also leads to dry eye. One of the problems, I'm getting a lot of calls with eye strain and dry eye. So it would be advisable to avoid the lenses. This is a good time to give your eyes some rest and also prevent any kind of disease entering in through there.
Okay. Dr. Monica Mahajan, I do have a question for you, but I have callers lined up. So let me go across to them first. Harish from Chennai has a question. Go ahead.
Good evening, ma'am. My question is regarding the testing kits which the government's plan to buy from China. See, there are two kinds of rapid testing kits currently in use in the world. One tests for the antibodies, second thing tests for the genetic material. On the 8th of April, that is day before yesterday, the WHO website has rejected both these testing kits because one they say is it brings out any genetic material, any coronavirus, or even your own exosomes. Exosomes are what your cells produce when you're under stress or you have a lung cancer or cough or cold or whatever, for a variety of reasons. And the second thing doesn't give you, gives you an 80%, up to 80% of false negatives. With this kind of, and the third thing, the RT-PCR test, is even more questionable. Even big leading doctors from New York, like Dr. Andrew Kaufman, a lot of doctors have questioned the authenticity of this test because, again, the genetic material was given to the world by China, which nobody wants to believe. They all believe that this genetic material which they gave is of your exosomes, which your own body produces. India hasn't done any research on this virus, on the gene sequencing, nothing. You just believe whatever kits come. You test all 135
Okay,
people.
Harish.
Almost everybody is going to be positive because your kits are faulty.
Oh, okay. Okay, Harish, lots of questions, complicated questions. Monica, Dr. Monica Mahajan, would you attempt to give that a shot?
Yeah. So, Harish, you need to understand that there are two types of tests. One is the antibody test and the other is the PCR or the gene-based test. So, India has been able to isolate the genetic material from the virus. That's the first thing. The second is that there are certain advantages and certain disadvantages of the antibody-based test. The advantage of the antibody test is that it's a very quick test, a drop of blood, and like you read any kind of strip test, it gives you an answer within 5 to 10 minutes as to whether the test is negative or positive. So it's a quick test for screening the general population on a much quicker pace. The flip side to the antibody test is that for a person to develop sufficient amount of antibodies in the blood, it will take around 5 days for the antibody test to start showing positive. So in the first 5 days of the illness, when the person is asymptomatic or mildly symptomatic and you do the test, the antibody test may be negative. So it will not be a useful test in the initial phase of the illness. The PCR test is a more pakka test. It's a more reliable test because it is detecting the genetic code of the virus. But at the same time, the PCR test also takes a longer duration to detect the test virus and give a positive or a negative result. So a more reliable test is a PCR test. It will be positive even in the asymptomatic first few days of the illness, but it takes time and is time consuming. But a mass screening test would be the antibody test. So each has its own role, whether it is in terms of screening or whether it is in terms of making a diagnosis of the disease.
Okay. We also have Dr. Nikhil Tandon joining us, Head of Department of Endocrinology at AIIMS. So, Doctor, we have a caller, Ahmed from Chennai. Do we have Ahmed on?
Yes.
Go ahead, Ahmed, with your question.
Hello.
Ahmed, if you can hear me, go ahead with your question, please.
Yes, please. Hello. Yeah. Hello.
Yes, Ahmed, go ahead.
Yeah, I'm talking. Hello. Yes, please. Hello.
Do we have Boom?
Doctor, see, I have a question. Yeah, I have a question. Hello.
Can we get Bhumi from Bangalore? Let's get Bhumi from Bangalore on and then we can get Ahmed back on. Do we have Bhumi?
Yes, I'm here.
Go ahead, Bhumi.
Yeah, my question is to the ophthalmologist. So when we are saying that the infection can pass through the eye, so are we going to see symptoms of infection in the eye first, or is it going to be directly in the body?
Great question. Dr. Anita Sethi?
Yeah, so the infection does not usually pass through the eye. That's not a common way of the infection going through. Studies have found that in patients who are very sick with COVID, only then does it come out the virus comes out in the tears. So this is not a common way, and only in a very sick patient may you also get a conjunctivitis or an eye infection. It doesn't first go in through the eyes. But it is possible, so we should avoid touching mouth, eyes and nose.
Hope that answers your question, Bhumi. Do we have Ahmed back on or Sahil from Srinagar? Sahil, go ahead. Is Ahmed there? Okay, Dr. Tandon, let me go across to you, joining us from endocrinology, the head of Department of Endocrinology at AIIMS, joining us also on the show. Doctor, what are the concerns that patients of who suffer from any kind of problems when it comes to the endocrines may have to face? Are they more susceptible to COVID-19?
I think this is a question which has been reviewed with great stringency over a period of time. And I think this needs an answer in two parts. A, is an individual with diabetes more likely to get the disease? And B, if an individual with diabetes does get the disease, is their outcome similar to anybody else or is it different? And let me answer the first question first. If an otherwise well-controlled person with diabetes without any comorbidities and relatively young or middle-aged person is perhaps not more likely to be susceptible to the infection compared to the general population. Obviously, an older individual with comorbidities, sugars not being very well controlled, will be at higher risk for acquiring this infection. And we know that in people with diabetes who are not well controlled, they are prone to a range of infections. That's the answer to the first. The second part has a little bit of a twist, that if in a person with diabetes, they do get an infection, it appears that the outcome in them is more severe. They're more likely to have a severe infection, and the outcome in terms of survival is likely to be worse than a person who doesn't have diabetes. So I think that perhaps is what we understand about it today. As more information comes in, we may have a change in that position. But as of now, that's how it stands.
So what advice then would you give to any viewers who are watching who do have diabetes? Because we've also, we know that India is considered to be one of the capitals when it comes to diabetes capitals of the world. Do they just need to make sure that they're taking every possible precaution?
Yeah, I would say if everybody else is taking 100% care, they possibly need to take 120% care. The precautions remain the same. The precautions, we've already discussed them. Professor Sethi referred to issues about not transferring material onto your face. We've discussed issues about air droplet and aerosols can be left inhaled. All of these precautions remain the same in that social distancing, adherence to lockdown, and absolute care is critical. In people with diabetes, the additional part is you need to keep your parameters well. So you need to have, if your sugars haven't been too well controlled, you need to do everything possible to get your sugars back on track. You need to ensure that if your mobility is there, if you've got, let's say, blood pressure issues, you need to do that. So you really need to look after yourself so much better than you can.
And what we're often told that diabetes, those who are diabetic, need to make sure they're getting some exercise, that they're walking regularly. How does one balance? I mean, what advice would you give? Because you're between the devil and the deep sea here.
Right. So I would still enforce the recommendation for lockdown because you don't know what bug you might pick up when you go out of the house. So really, I mean, people should stay indoors and devise methods of actually exercising while they live confined to the house. I realize it's easier said than done, but I'm sure there are, as kids used to do physical education, standing in one line, you can do hot jogging, you can do, if you have a cycle or a treadmill at home, you can do one of those. You can try yoga, but you really need to do this on a regular basis and you really need to avoid getting out.
And prioritize staying in over that, but it could be at least another 2 weeks that one may have to come up with these backups for now. We have Sahil from Srinagar. Go ahead with your question, Sahil.
Good afternoon. Actually, I'm a patient of urticaria with anaphylaxis history, and right now I'm on immunosuppressants, cyclosporine. I want to know, ma'am, am I at high risk of catching the infections on the daily basis? And what should I need to do to boost my immunity?
Okay, that's a question that everybody is asking, and I know for a fact it's not something you can do overnight, but Dr. Monica, Dr. Mahajan, if you could answer that question.
Yes, Sahil. So anybody who's on immunosuppressants for whatsoever reason, whether it is in terms of anaphylaxis or whether it is in terms of lupus or any kind of arthritis or transplant patients, they are more prone to having worse outcomes as far as the virus is concerned because their immunity level is suppressed. So you have to be extra cautious in terms of maintaining distance, in terms of hand hygiene and all the other precautions that the general public is following 100%, I think you should be following 200% just to make sure that you are not catching the virus or coming in contact with anybody who has the virus being positive. Eat healthy, exercise, and just maintain the distance and maintain the general precautions in a very, very meticulous fashion so that you don't somehow come in contact with anybody who has the virus.
Sai from Coorg has a question. Go ahead, Sai.
Yeah, hi. Hello, doctors. Actually, it might have already been answered before, but I just had a query about ACE.
I'm not sure we can hear Sai. Can we connect Sai again? Sanjoy from Delhi.
Yeah, hi. My question is for Dr. Sethi. In a short while, the lockdown will be lifted, and most of us who are asymptomatic, would you recommend that we should undergo a test just to be sure for the way forward?
All right, Sanjoy, first and foremost, in a short while, the lockdown is not going to be lifted. That is the news update of the day. It is going to be extended by 2 weeks, but at least we don't know post that. But Dr. Sethi, should one be getting tested, let's say, in 2 weeks?
Well, it's there is a limited number of tests. It's not that we can just test the whole population, much as we would like to do that. But I don't think we've reached a point where we can just test everybody. I think only those who have symptoms, that's what's being followed. The contacts, I mean, in the containment clusters, the testing is going on there. So there has to be some indication for the test. Either you have a flu-like illness, or you are a contact, or somebody in the house has it. So we can't just get tested, but we do need to, even when the lockdown is lifted, and that's the most dangerous part, because we need to continue these precautions. This disease is not going anywhere for the next 3 to 6 months. We just have to, this has to be a part of life. So we have to continue social distancing as much as we can. We have to have our hand hygiene. And I feel that reusable cloth masks for the general population is a good adjunct. It's not a replacement. It's an adjunct, and it's a extra precaution.
Some things should be here to stay. Certainly, like spitting, that Indians are well known for, that we do a lot. All of that needs to cease. Wearing of masks. And I also want to just reiterate what Dr. Sethi has said, that there are few tests going around. Let's not overwhelm the system. Let's leave the tests for those who really truly need them right now. The rest of us can continue to stay at home if possible. Let's quickly get in more callers. Ahmed from Chennai, should we give him another shot? Ahmed.
Yes, doctor. Hello, my question is, what is the exact treatment for COVID-19? Because there's a lot of paranoia among people, because some say it is just like flu, flu, you need to take rest, you need to drink a lot of boiled water, and and hydroxychloroquine is the medicine which has been prescribed, or rather going to be prescribed by the United States or so, along with azithrol. My question is exactly what is the treatment we are currently undertaking in India?
All right, Ahmed, I'm glad we persisted in getting your question on the air. Dr. Tandon.
I think this is a fair question, and I think there's a lot of uncertainty, but let's put this in perspective. This is a disease which is known to mankind for 3 months, right? Or 4 months at best. I don't think we really have evidence-based therapy with us today. There are lots of proposed therapies. You mentioned a couple of them, but there are no data at this point of time for anybody to make a standard recommendation for any of these treatments. And therefore, definitely nobody should be trying, self-therapy with any of these medicines at all. Doctors will need to take a decision based on the clinical situation of the patient. Primarily in mild or asymptomatic disease, you really need to do nothing, absolutely nothing. There will be a time when you may have some reduced ventilatory capacity, you may need to be on oxygen, but that's the time when people will try a variety of medicines for want of specific evidence for any one of them more than the other. saying that, I think in a month or two, we should have more results from a set of trials which are being conducted as we speak. And hopefully we should have more clarity on that. Till then, we'll have to do a case-by-case recommendation based on the clinical scenario. Let me put hydroxychloroquine also in perspective. I know it's been said on several fora by both medical personnel and non-medical personnel, but clearly the evidence today remains in balance. And I think a blanket recommendation may not be something that would be advisable at this point in time.
Okay, I think we have a minute left, but I want to ask a question that I know many have been asking me. We've now been under quarantine for 16 days, and the quarantine period is 14. Now, given that, and now we know it's going to be extended by another 2 weeks, many people haven't been seeing your parents, for example, other dear loved ones, because we've all been keeping ourselves isolated. But if, let me ask this question to our doctors, Dr. Monica Mahajan, to you first. If one has been in isolation and you know that somebody else, maybe your parents who live close by, have been in isolation, would it be, can you have a, you know, I'm not sure what the word is for it, like quarantine buddy? Like, could you expand your circle a little bit? Is that advisable or not at all still? Perhaps even seeing parents who you haven't in the past 2 weeks? Because we've also been under quarantine for 16 days.
So, Sarah, even if you've been in quarantine for the last 14 days, but there would be times when people would have visited your house, whether to drop in groceries or whether to drop in any other stuff to the house, or you may have visited the grocery stores on your own. So we know very little about the virus. Hypothetically, we are saying that the incubation period of the virus is anywhere from 1 to 14 days. But there are cases where the virus has been positive for a much longer period of time, even 31 days or even for a few months together in Wuhan, some cases. So if we say that 14 days is the cutoff period, we are not 100% sure about it. And as far as visiting parents are concerned, they are elderly, they are more prone, they are more vulnerable as far as this virus is concerned. So I would still say that go on for a virtual meeting with your parents. Don't visit them, because you would not have been in 14 days of absolute quarantine. There would have been some people, minimal even though, but some people visiting your house, or you would have stepped out of your house at some point of time. So why expose your parents unnecessarily? I know there are sentiments, but there are decisions which are right. There are decisions which are wrong. There are no absolute yes and no to your answer. So I would say stick to a virtual meeting with your parents. As of now, don't break the lockdown and don't unnecessarily put them into a higher risk, because they are elderly. You should stay away from them as much as possible. If it's a real emergency, then visit them. Otherwise, no.
And they are more at risk than people who are below the age of 60, is what some of the literature says. But thank you, Dr. Tandon, Dr. Sethi, Dr. Mahajan. Thank you for taking time out. You're on the front lines of this fight against the spread of the coronavirus. So we really appreciate your coming on NDTV and taking time out to address some of these concerns that our viewers have had tonight. Thank you for your time. Bye-bye.
Thank you.
Thank you.